Hello everyone, let's look at this topic of TNM classification of colorectal cancer, and we will try to blend this with modified Duke's classification. So in modified Duke's classification, we have mainly in terms of alphabeticals like A, B1, B2, C1, C2. So A is nothing but the tumor will be confined to the bubble wall, not extending into the muscularis. Okay. B1 is nothing but it is extending into the muscularis propria. B2 is it is extending through the serosa. So this is B1 through the serosa is B2. B is not without any lymph nodes. Whereas when it comes to C1, C1 is nothing but it is B1 plus lymph nodes. So C1 is nothing but B1 plus lymph node. C2 is nothing but B2 plus lymph node. So as you can see here, C1 is extending into the muscularis, but there is enlargement of regional lymph nodes here. B1 is into the muscularis propria, but along with the lymph node enlargement. C2 is nothing but B2 plus lymph nodes. Okay, so this is regarding, and in modified Duke's classification, D will come. D for distant metastasis. Okay, right. When it comes to TNM classification, we'll try to correlate the things here. So, as you can see here, TNM has got TIS is nothing but carcinoma in situ or intraepithelial tumor or invasion of maximum lamina propria. So, when it is involving submucosa, so mucosa, submucosa, muscularis, then serosa. So whenever it is extending into the subserosa, it is T1. And when it is coming to T2, so this is nothing but your B1. This is nothing but your A. So T3 is nothing but when it is penetrating into the perirectal fat. That's what we call mesorectum. So whenever it is penetrating perirectal fat, it is T3. And whenever it is the tumor is penetrating visceral peritoneum, you know that ascending colon and descending colon are retroperitoneal. So whenever the tumor is extending into the anterior visceral peritoneum, that is your T4A. Then whenever the tumor is directly invading or adhering to the other organs or structures, then it is called T4B, right? So just like for any other TNM classification, here we can remember the N staging easily. So 1 to 3 is your N1. Again, N1A is one lymph node, 2 to 3 is N1, N1B. Or if it is involving submucosal or mesangial, or whenever you have got peritoneum covered paracolorectal deposits, in the absence of regional lymph node metastasis, then we call it as N1C. Okay, so if it is directly depositing into the adjacent peritoneum or submucosal or mesangial lymph nodes, then in general, if you have 4 to 6 regional lymph node enlargement, it is N2A. More than or equal to 7, N2B. Right? Then M1A is nothing but if it is involving only one extracollar organ. So extracolic organ. Like for example, it may be ovary, it may be liver, like that. Whenever it is having more than or equal to one organ involvement, then it is M1B. M1C is nothing but with or without regional lymph node enlargement, if it is involving peritoneal metastasis, then it is called M1C. Okay. Now, if you like, try to look at the staging. This is TNM grading. So, as you can see here, T1 and T2 is stage 1. Then T3 is your stage 2. And whenever there is involvement of lymph nodes, N1 and N2 will come under stage 3. Whereas whenever there is metastasis, it will go into stage 4. Okay. So, this is about TNM classification of colorectal cancer. Thank you.